Afternoon, everyone. Joined by Professor Murphy, as usual. Together, we are making significant progress. At around 6,000 cases across Australia, less than 10% of those are coming through community transmission at this point. We have so far avoided the many thousands, if not tens of thousands of cases that may have otherwise occurred by this point across the Australian community, and indeed the many more fatalities that could have also occurred by this point. The daily growth rate in cases has now fallen to just a few percentage points per day. This has occurred quite rapidly. In fact, it has occurred well beyond our expectations in the way that we've been able to bring that daily growth rate down together, and certainly ahead of what all the theoretical models would have suggested. But we must hold the course. We must lock in these gains. It is providing us with much needed time. We have so far avoided the horror scenarios that we have seen overseas, whether it be initially in China and Wuhan, or in New York in the United States, or Italy or Spain, or even the United Kingdom. And just on the United Kingdom, we extend our deepest concerns and expressions of support for Prime Minister Johnson at this very difficult time for him and his family. They do not have the opportunity in all of these places that we're seeing from here that we have right here and right now. The combination of our health and economic responses is giving us the opportunity as a national cabinet, individual governments across Australia, and of course at the federal level, to plan our way through and out of these crises. We have brought valuable time, but we cannot be complacent. We must keep the tension in the cord. This Easter weekend will be incredibly important. Stay at home. Failure to do so this weekend would completely undo everything we have achieved so far together, and potentially worse. So all the things we've been asking you to do, day in, day out, they apply especially so this long weekend of the Easter weekend, when you normally may have gone out together as family and been out in public places and parks, or gone away, or wherever you might have been. That is not something you can do this Easter long weekend. We have already seen in other countries where major festivals or events or holiday periods have been the spark for significant outbreaks elsewhere in the world. I was only speaking to Prime Minister Modi yesterday, and he was recounting a similar event that occurred in India recently. And so it is very important, all Australians this weekend, that you must follow these very helpful and straightforward requests that we make of you in terms of your movements this weekend. Today, the National Cabinet met to consider a series of issues, and including further reports from the expert medical panel, and Professor Murphy will take you through some of those matters shortly, as also work on the Commercial Tenancies Code. After reviewing the data on progress, Professor Murphy stepped the National Cabinet through the academic modelling work that has been undertaken by the Doherty Institute that they will be releasing later today. Professor Murphy will take you through that modelling work very, very shortly. But I want to be clear about a couple of things first. You will have what we have. This is the modelling work that is available to the government. It is the full complement of what we have available to us. The modelling work is theoretical. It is not based on Australian case data and does not model Australian responses. The modelling does not predict what will happen in Australia. It does not tell you how many Australians will contract the virus, or how many may succumb to that virus, or how long it will last in Australia. The modelling work is based on international data. The early work that we had, that I shared with Professor Kelly earlier, was based mainly on data that had been extracted from the Chinese experience. This modelling data draws on a broader international data set that has been made available since that time. And what it does is it proves up the theory of flattening the curve. It confirms, based on that international data, that by taking the measures we are taking, you can make a difference. And indeed, that is what we're experiencing here in Australia. We are on the right track, controlling the spread, boosting the capacity of our health system, and buying time, giving us the opportunity for more choices. National Cabinet, of course, will be seeking further modelling work to be done that it does incorporate Australian case data and modelling of the Australian responses. But part of our modest success to date means that the number of cases, particularly those through community transmission, is still quite low, which does not present a very big case base to do a lot of that work at this stage. But we are keen to see that work broken down to state-level jurisdictions because, of course, the experience in different states and capacities of their health systems are different in each jurisdiction. So the National Cabinet fully understands the limitations of this work. And so for those who might have thought today they were going to have predictions on these things, that is not what is being presented today. And I would urge those who are reporting on it not to present it in that light. It would be misleading. But it will help us work through into the future this type of work, particularly when we get more of the Australian case data incorporated into this modelling. It will help us plan the way out. For now, and certainly over the weeks ahead, though, the lesson is simple, and that is that we must continue to do what we are doing. That is how we get through this, but there is still quite a journey ahead. So we need to just continue to adjust and adapt. Today, the AHPPC will put forward a number of recommendations to National Cabinet, and again I'll ask Professor Murphy to take you through those. But I do want to run you through very briefly the decision today on the Commercial Tenancies Code. Now, as you know, a key part of our government's strategy at a federal level, working with the states and territories, is what has been called the hibernation strategy. And what that means is being able to preserve as much of the foundations and pillars of our economy through this time to enable the economy to rebuild and grow on the other side. That means keeping the jobs. It means keeping the businesses. It means keeping the tenancies in place. It means keeping the loans in place, keeping the credit lines open to ensure that the liabilities that are established or protecting against insolvencies and bankruptcies. So on the other side of these crises, the economy will be able to rebuild and rebound again. And the commercial tenancies actions are very important. Now, I want to thank very much the states and territories, in particular the treasurers of the states and territories who have been working keenly on this issue over these past 10 days or so. I also want to thank the many industry players who fed into the work of this code, both tenants and landlords alike. And it is agreed by National Cabinet today that a mandatory code will be legislated and regulated as is appropriate in each state and territory jurisdiction. That mandatory code will apply to tenancies where the tenant or landlord is eligible for the JobKeeper program, so that defines a tenant or a landlord who would be in a position of distress, where they have a turnover of 50 million or less. So the code is designed to support those small and medium-sized enterprises, be they a tenant or indeed a landlord. The code brings together a set of good faith leasing principles. Landlords must not terminate the lease or draw on a tenant's security. Likewise, tenants must honour the lease. Landlords will be required to reduce rent proportionate to the trading reduction in the tenant's business through a combination over the course of the pandemic period, through a combination of waivers of rent and deferrals of rent. Waivers of rent must account for 50% at least of the reduction in the rental provided to the tenant during that period, and deferrals must be covered over the balance of the lease term and in no less period than 12 months. So if the lease term goes for 3 years, you can amortise the cost of the lease, the rental deferral over that 3-year period after the end of the pandemic period. But if the lease only has another 6 months to run, then the tenant would have a minimum of 12 months after the pandemic period in order to cover up on the deferrals of the rental payments. The arrangements will be overseen through a binding mediation process. All of this will be run by the states and the territories. The point here is simple. It's the same request we made of landlords and tenants about 10 days or so ago when I stood up on this issue, and that is that they sit down and they work it out. This must be shared. Banks also must come to the table here and provide the support to the landlords, and I would particularly send that message to international banks operating in Australia who are in many cases providing that support, particularly to many larger landlords. We will expect those banks to be providing the same levels of support and cooperation as we are seeing from the Australian banks who are aware of these arrangements. What this does is it preserves the lease, it preserves the relationship. It keeps the tenant in their property and it keeps a tenant on the lease, which is also good for the landlord, and it preserves the lease that is in place that underpins the value of those assets. And so this is seen as a proactive, a constructive and cooperative mechanism for landlords and tenants to see this through together. We also had a very brief discussion of schools today. That will be considered in greater detail on Thursday. Education ministers are meeting now, actually, to consider the issues around education and to report back to the National Cabinet on Thursday. Of course, Premier Andrews made his announcement this morning, not unexpected. Schools are going back after the Easter break, and the arrangements that he's announced are not dissimilar to those that are currently running in schools in New South Wales and in many other states as they run into the term break. But it is important that we're looking at the educational impacts of what is occurring with how the rest of the school year will be managed. From the Commonwealth's point of view, we are leaving those issues specifically to the states and territories to apply to each of their jurisdictions as they see appropriately. But from the Commonwealth's point of view, and particularly from a national economy point of view, then we obviously want to ensure that parents who are unable to provide a proper learning environment at home because of their work commitments, that they don't have to choose between their children's education and having a job that can feed their children. And that is not a situation we would consider tolerable. And so we thank everybody for working to that end, but of course the educationalists need to provide that advice about the structure of the balance of the year and to ensure that our kids do not lose a year of their education. So thank you again for your patience after these National Cabinet meetings to run through all those issues, and I'll now pass over to Professor Murphy, and he will also take you through the presentation.
Thanks, Prime Minister. So just an update, this morning's data, we had 5,844 cases and unfortunately some more deaths, tragically, with 44 deaths. We still have less than 100 people in ICU and less than 40 people on ventilators, which is quite a low rate of serious disease. As the Prime Minister said, the thing that worries us most of all is the more than 500 people who have acquired this virus from someone in the community that doesn't know they've had it. That means that there are people walking around in our communities who could be transmitting this virus without knowing they've had it. That is why we cannot relax what we've been doing. We have, as the Prime Minister said, seen some very impressive reductions in growth in transmission of COVID-19. But if we in any way lose that rigour that the Australian community has embraced, particularly over Easter, it could all come undone. We've seen what this virus can do in a cruise ship, at a wedding. It can spread to 30, 50, several hundred people very quickly. We've got to be maintaining that vigilance and all of those practices that we've all embraced in recent weeks. As the Prime Minister said, we discussed at the National Cabinet some other HPPC advice statements which will be published later today. They are advice around those experimental drugs that people are thinking about but are still not proven to be of benefit. Advice around the use of masks and other protective equipment for healthcare workers are a very sensitive issue at the moment, and we are getting more and more masks into the country as we speak. Advice around when it's appropriate for someone who tests positive to be looked after and stay in their own home under close scrutiny. Advice about organ transplantation. We've stopped doing renal transplants for the time being in Australia because of the virus risk, but we would hope to be able to resume that as soon as it's safe to do so. And also advice around those point-of-care serology tests that many of you have been reading about that have become on the market recently, and expressing some caution until we understand their role. They're not a replacement for the standard diagnostic PCR test. So the other thing I want to say before I go through the modelling is that a lot of people with chronic diseases, conditions other than COVID, are not currently getting medical checkups. Our doctors are very quiet. They don't mind being quiet, but they're very worried that people are so frightened that they're not seeking medical attention. This is a really concerning issue. There are lots of people with medical conditions in the community who need regular checkups, regular review. As you know, we've set up telehealth facilities so you can have a telephone or a video conference with your doctor, or you can go and see your doctor. The risk is fine as long as you ring beforehand and make arrangements and maybe seek a telehealth consultation and go to the doctor if necessary. Please don't neglect general health conditions at the moment. That is a really important message. So now I'll just go through the slides on the modelling. If we can have the next slide, please. So basically, this modelling, two papers are ready for release. They're ready for publication. The Doherty Institute modelling team, who we've been funding for some years actually to do modelling as part of our pandemic preparedness. They are expert. They work on pandemic influenza, and they are publishing some stuff that they did for us early in the course of this outbreak to help us better prepare. So the two papers that they're publishing, one is one where they looked at some very theoretical models of a worst-case theoretical scenario to see whether we have the right tools to manage our health system capacity within potentially worst-case demand situations. The other paper is one we did looking at the risk of people travelling to Australia from other countries based on that early China export data, so that we used that to guide us in some of the recommendations we made to government around border measures. So the Doherty Institute will be publishing those highly technical papers later this afternoon, and those of you with scientific brains will be able to read through them. But it's very important to understand that these models are highly theoretical and they are not actual predictions. As the Prime Minister said, they're not based in any way on Australian data. In fact, they're based on data derived from countries that have had a significantly worse experience than Australia. Can we have the next slide? So, as the Prime Minister said, we are flattening the curve, and you can see the Australian curve, which is bending, and that is a very positive sign. And you can also see the case numbers and all of the measures that we put in place to interrupt the transmission of this virus over recent weeks. But complacency is our biggest risk. We cannot be complacent. But this is the Australian data. This is the sort of data that we will now take, particularly the community transmission, and we will feed this. Our modellers have got this data, and they are now doing real predictions on what might happen in different scenarios in different states, as the Prime Minister said. So this is what the real data is. Now we'll go and look at some of the theoretical modelling. Can we have the next slide? So when we started, before we even had many cases in Australia, the modellers looked at what would happen in this highly artificial situation if right across Australia we had diffuse seeding of this virus so that nearly 90% of the population, 23 million people, were infected at the same time. That's an incredibly unlikely scenario, that the whole country gets infected at the same time, but that in microcosm has been seen in some cities in the world where we've had these huge outbreaks that have overwhelmed the system. But if that happened in Australia, you would see a very, very big peak. And you can see the most important thing we've been looking at in this health system capacity modelling was what is our intensive care unit bed capacity and what is their intensive care unit bed demand. We have already planned to triple our intensive care bed capacity, and we want to make sure that we have the tools to manage the growth of serious disease with COVID-19 to within that capacity. So in this scenario, which is what we call the unmitigated scenario, this is where you just let the virus spread, you do nothing, and treat people as they seek medical attention. And as you can see, and as has been seen in some countries, this is a horrendous scenario. It's not real, it doesn't reflect the current state in Australia, but you would see an ICU daily demand for new intensive care beds, of 35,000 plus, completely beyond the realm of any country like Australia to create. So, very important message. If you had this highly artificial, very unlikely diffuse outbreak, you couldn't meet demand. Have the next slide, please. So, what we then did, what the modellers then did, and you can see this in the paper when you download it from their website this afternoon, is looked at, in this highly artificial, unreal scenario, what do their mathematical models tell you about the tools that we have and that we have already used to mitigate an outbreak. So what they've shown firstly in the second blip is what happens when you do what we have been doing in every state and territory, is quarantine and isolation. Detect a case, isolate them, either in the home, in a hospital, make sure they don't spread, and quarantine all contacts. That has a huge reduction in the spread of the virus, which I will show later on, but it still shows that if that's all you do, and you have this huge artificial countrywide outbreak, which again is unlikely, but we have to model for the worst case scenario, you would still materially exceed ICU daily bed demand. So then what the modellers have done is looked at a range of social distancing measures, because we know that these social distancing measures reduce the transmissibility of the virus. We've already seen that. In fact, the modellers are already looking at early data on what's happened with social distancing in Australia. And you can see that you very significantly drop the peak. Obviously, you extend this theoretical outbreak, and I make it very clear, this is not any way a prediction of what might happen in Australia or the length of an outbreak. It's just showing what would happen in this highly theoretical Australia-wide outbreak and how effective these measures are. That's the purpose of this graph, is to show that the measures that we have put in place successively, quarantine and isolation, and then social distancing, which we can dial up and down, have a major downward effect. So that if you do have an outbreak that is not properly controlled, you can apply these measures and we know we'll get control. Next slide, please. So just a couple of some scenarios that you'll see in the paper when you read it, that in the unmitigated scenario, you would only get about 15% of people who need ICU beds could access it in a conservatively increased ICU bed capacity situation. With quarantine and isolation, you get a much lower infection rate, lower hospitalisation rate, but still most people who need ICU don't get it. Once you start to introduce social distancing, and with a little bit and then more, you can see that we very significantly reduce the infection rate, we very significantly reduce the hospitalisation rate, and we know that we could meet the ICU bed capacity. So again, we know that in theory we have the tools that we can dial up to suppress an outbreak, to manage it within our resources. This is not, again, not predicting what we are doing now or what's happening now. In fact, the measures we put in place now have already reduced our infectivity rate much lower than the model impact of even this most significant implementation. So it's not a prediction, it's just showing that these tools work. Next slide. So this is what the modelling has been, this theoretical modelling. This is what's published, and you can pore all over that when it's released on the website. But our future modelling is probably what you're more interested in, and this is going to be based on real-world Australian data. So in the real world in Australia, we don't have a diffuse outbreak across the whole country. We have focal outbreaks. The one that worries us most of all is the community transmission in Sydney. I've been saying that for a while. That's the one we're focusing on. That's why New South Wales Health has been so proactive and forward-leaning in doing a range of broadened testing in a whole lot of suburbs where they're concerned. And the early indications, as we've said, are positive, but we cannot be complacent. We must not be complacent. We must hold our line. Our current case rate is very, very low. Every death is a tragedy, but our death rate is one of the lowest in the world so far. We don't know what it'll be as disease progresses, but we are reassured to some extent about that. It's a tragedy that every one of those deaths has occurred. The community transmission is what we're going to focus our modelling on, working out what the infectivity rate, what's likely to happen, where those transmission events are occurring. We have to also factor into our modelling other things, like we're still seeing cases in return travellers. Our quarantine measures have been effective, but we're seeing positives in people in the quarantine hotels. We have to be sure we've got enough tests to be able to test broadly, and we have to have public health mechanisms to make sure we can quarantine and isolate cases. And we're now starting to see in the modelling data the true impact of the wonderful uptake by the Australian community of social distancing and general hygiene measures. Some of those measures, I think, will stay with us all forever, even when this is over. I think the new approach to hand hygiene, personal hygiene, has probably changed the way a lot of us think, and that's fantastic. But we're seeing the impact of these measures in the disease now, and we will start to be able to produce and share with the public the models of what future potential scenarios in Australia are. As the Prime Minister said, we're not in any way out of trouble at the moment, but we are in a relatively strong position to keep the pressure on, make sure we're well prepared, and plan our next approach in dealing with this virus. But the most important message from this model is we know that the tools we are using do work, and we can scale them up and down as necessary, and the data we have so far suggests that they are working. So I'll stop there. Thank you, Prime Minister.
Thank you, Brendan. Just before I go to questions, and I'll just start here and move across the room if that's all right, I also want to draw people's attention to the simple procedures that SafeWork Australia have set out, and you can access this at swa.gov.au/coronavirus. And this deals with where there may be a suspected or confirmed cases of COVID-19 at work. There are 7 simple steps. Isolate the person from others. Secondly, ring the National COVID-19 hotline. 3, ensure the person has transport to their home or to a medical facility. 4, clean the area where the person was working. 5, identify others who had close contact with that person in the previous 24 hours and before that infected person started showing symptoms. And 6, clean the area where those other also were working. And 7, to review the risk management controls relating to COVID-19. Now, there are more details, but I understand there has been some need for further information on that, and we were getting some feedback. People weren't quite sure what to do and may have been getting some conflicting advice. If you go to swa.gov.au/coronavirus, that will give you the instructions. So we'll start right over here on the side, and then we'll go to you, Michelle.
A question for the Chief Medical Officer. In the modelling that you do have, is there any kind of indication of when you would actually start relaxing some of those social distancing measures, or will that be when you actually get the Australian modelling?
I think the latter. I think that modelling was really just to look at whether we've got the tools and the capacity. what we do next in Australia will very much depend on our real-time Australian data, and that's too early to say yet.
As you have a relatively limited number of cases, can you, what are the advantages of trying to eliminate the virus altogether?
So that's a good question. There was a strategy that was undertaken in Wuhan to completely stop transmission, and that is one of the options available. The issue, though, is that then you don't have any immunity in the population, and you really have to control your borders in a very aggressive way, and that might be for a long time. So that is one option. No, that's the National Cabinet. What is clear about the way countries are responding to this virus is that there is no clear right answer. There are lots of potential paths. National Cabinet has asked the HPPC to come back with a range of alternative scenarios, but the good thing is that we can do that now in a position of relative calm. So at the moment our strategy is very much to identify, completely control and isolate every case. That may be the long-term strategy, but we have to look at all of those potential options. There is no clear path. Unlike pandemic influenza, where the strategy was to control and contain until the vaccine came, because we knew the vaccine would come. We don't know if and when a vaccine will come with this virus. If it does, that's a beautiful way out. So we have to look at a range of different potential scenarios, and we will be presenting them to the National Cabinet for their discussion, but there is no single right answer.
If I add to that, the National Cabinet has to also consider the ability to actually continue to run the country under such a scenario. And as you know, the economic lifeline that is being provided through the many things that are being done, particularly at the federal level, but also at the state level, they have a finite life. And so obviously if those scenarios were to come forward and it would involve a duration that went well beyond all of the government's capacity to support that, then that would render such an option not workable. Yeah.
Minister, now that the commercial tenancy response is in place, will the same apply to residential tenancies? Will they get mediation to defer payment? Will they get at least 3 months of rent reductions supported by land tax reductions?
Residential tenancies will now be dealt with directly by each of the state and territory jurisdictions. The issues that we've worked with on as a national cabinet have been to deal with the commercial issues, because they have that broader national economic impact, and the residential tenancies are a matter for state and territory governments, and they'll be addressing that specifically in each jurisdiction.
No baselines.
Sorry?
No baselines. No guarantees that tenants Australia-wide will get
moratorium on evictions, and then individual measures beyond that they believe are best addressed within each individual jurisdiction.
The aim of the JobKeeper payment is to keep people employed and tied to a business. Why do you have a different system or a different threshold for the larger companies and those employees who are stood down, as opposed to the medium-sized and smaller companies and those who are stood down, the 30% and 50% thresholds?
They have different financial capabilities and different sized balance sheets and different access to financial markets.
But, I mean, why are you saying the big businesses should just suck it up?
Because larger business in many cases have a much greater capacity to deal with these issues, just like banks do. That's what I'm saying. I'm saying smaller businesses have a different level of capability and a higher level of vulnerability in dealing with the significant cash flow issues. I mean, it's like comparing Qantas to a corner shop. They're very different operations.
Professor Murphy, given that there are at least over 500 people who have contracted this disease without knowing where it came from, logical extension of that is at least 500 people have been walking around not knowing they have it, and it's been modelled earlier that one person walking around within a month could infect up to 400 people. When might we expect to see that potentially dormant amount of people reach a critical mass? And on that, do you think it's therefore likely that of the hundreds of people let off the Ruby Princess who had the disease, that only about 11 cases have come from that in community transmission, as has been said by New South Wales Health?
So on the first question, those people that don't know have the virus are the reason why, particularly New South Wales Health, is now broadening testing to every suburb where one of those people has been found. So they're now testing everyone with acute respiratory illness, and they have found already some of those people who probably gave the virus to someone else. So other states are doing sentinel surveillance as well. People are testing more broadly than the case definition at the moment. One of the interesting things to note is that people turning up for the testing centres, the numbers have dropped, mainly because people are getting less flu. Because of social distancing, our coughs and colds and flu are actually spreading less than we would have expected at this time. So we are now testing a lot more broadly. That's the way we'll find these other people. And at the moment, we're not seeing a huge upswing in those cases, but that is what worries us, and that's why we're broadening the testing in all of those areas where community transmission has been found. Now, in terms of the Ruby Princess, whilst those people did leave the ship, within 12 hours of them leaving the ship, New South Wales Health had contacted every state and territory health department where they had gone to and ensured that they were all contacted and asked to quarantine. So we believe that most of the passengers who left the Ruby Princess were well aware that there was a risk once they found the positive cases, and we've seen the cases from the Ruby Princess that have popped up in every state have generally been in people that the health department in that state knew about, they were already quarantined, they were already watching them. So it's too early to say how many will have been transmitted, but New South Wales Health is, I believe, what they're saying. They wouldn't tell me something that wasn't true.
Dr Murphy, does the modelling indicate anything about the relative effectiveness of different measures, such as whether to close schools or whether to stop large gatherings? And what does that, if that modelling work is done?
It doesn't, unfortunately.
It does not.
It doesn't. And so we're looking now at international experience. What it does, we use international experience to say what the impact of social distancing generally has achieved in Europe, and we've applied that to this model. It doesn't look at the specific impact of each of those models. They hope to get some more granularity on that because there are other countries that have been doing social distancing for longer, and they will try and get that, but we don't have it. This is a general impact.
Follow that with a quick...
Professor Murphy, and that is the incidence of the virus amongst younger populations based on the international data confirmed the advice that we've been receiving from the AHPPC, that it is very low relative to the rest of the population. But Dr Murphy could probably...
Yeah, so symptomatic disease in young people is still extraordinarily low. And again, I've said on many occasions, we don't know whether children might be asymptomatic transmitters, but we have not found any evidence internationally of significant school-related outbreaks. We don't know.
And so can I ask you to restate at the moment your advice on whether parents should be sending children to school in the light of the modelling and your latest information?
We see no reason why the HPPC advice is that there is no reason to withhold children from school. We do think that schools need to be made safe, and the National Cabinet has asked us to come back later this week with some detailed advice on how to make schools safe in terms of hygiene measures, reducing gatherings, practicing where possible social distancing, cleaning playground equipment, all of those things. But we believe that there is not an evidence base to say that keeping children from home is a strong public health measure on the current evidence that we have.
The National Cabinet and the individual premiers, when they've been making changes to schools, that has been on the basis of the workplace health and safety issues relating to the staff, to the teachers and others who are present at the school. It is not being done on the basis of the health advice, at least from the AHPPC, regarding any health risks to the children. Yeah, Brett, and then...
Talk us through theoretical modelling using international data. There are a lot of Australians who'd like to see some actual modelling using Australian data. Is that something that you're able to provide at some point, and sort of why isn't that useful at this point? And PM, just to follow up, a lot of your messaging in the last few weeks has been rightly directed at adults and grown-ups, but there are a lot of children who are at home probably watching this right now. They're not at school. This is a pretty overwhelming thing to be living through. What's your message to the children of Australia who are quite anxious about the weeks and months ahead?
Okay, so yes, we now have data on nearly 6,000 Australians. That data is currently in the hands of our modellers, and they are doing just as you say. It's still very early data yet. Once we have something that is scientifically valid and useful, the National Cabinet has asked us to share it with them, and they will share it with you.
Does it show, though, the actual data that we're heading to best case, worst case, most likely? Do you have an idea of where we're trending?
It's too early to tell on the trend data we've got at the moment. At the end of in the next week or 10 days, we'll have much better trend data. The data is still confounded by the noise from returning travellers at the moment. Once we've got that noise out of the system, we'll be able to get a much better picture.
Thanks.
Well, my message to the children of Australia is the same message I give to my own children. And I know this can be frightening and it can be scary. And they're hearing a lot of things, and much of which they won't understand. I think some of the most heartening and cheering videos I think we've seen was where you see little kids in their bedrooms with their own little lightsaber attacking the virus. And you know, that's sort of what it feels like some days in these roles. But I think the key message is we'll get there. We'll be okay. But we have to look after each other. They've got to look after their siblings, their brothers and their sisters. They've got to look after mum and dad too, and try and be as patient with them as they can. When mum and dad or mum or whoever is asking you to do something, I think it is important to do what mum says and to help them as much as they possibly can, and because they're trying to do the best thing for those children. And we'll seek to teach them as much as we can about what's going on. But the thing to know is that in Australia, they're in one of the most safest places in the world, and their parents love them very much, and their parents are going to do everything they can to keep them safe throughout all of these difficult times. Yep.
Prime Minister,
I'll keep flowing across the left.
I had a question. Dr. Murphy, can you give us an idea of when, I know you talked about this modelling in its early days, when it might become available? And Prime Minister, is it fair to say that you will require this modelling before you can make any decisions around dialling down social isolation?
So I would think in coming weeks that the National Cabinet is twice a week. I'm presenting to them on the data, the trends, and they're very keen on what's happening. But in terms of having some meaningful data, I'd say it's a matter of weeks that would be in a useful form.
You can get any data any time, but to get the right data, you've got to get it at the right time, and that's when it's ready, and that's when it's had the proper integrity and rigour applied to it. You don't want to make decisions based on poor process and poor data. And when we say we're trusting the science here and the research, we've got to allow them to do that work properly and not meet arbitrary timeframes. And to be honest, the modelling is one of just many tools that we're using. There is no map for this. We are in uncharted territory, and Australia is in a position that many countries would wish to be in. What we've got right now is important time. That's what Australians have given us through their cooperation and the work that they're doing. That is giving our researchers, our scientists, our doctors, our healthcare sector, all of us more time to be able to chart and plot the way out of this, and that is the full attention of the government now as we go forward, having got all these large measures in place. And so there won't be one issue that determines that. And what I think you will expect to see is the National Cabinet will look at all the information that's coming through, and you will have some jurisdictions, some states and territories that might be in a position to move when others are not. And then we will learn from the experience of those states that may have trialled things. And we may see a number of trial type of relief of restrictions at some point in the future. And that would mean that in states like New South Wales or Victoria or even South East Queensland, that are more impacted, that they'd be able to take those easing of restrictions with a bit more confidence. And so the National Cabinet is working together very much on this and discussing the options that are available to them and really trying to help each other with the decisions that they need to make in each and every case. So there's no one point of data, there's no one point of experience. It is the combination of all and sharing the learning together and making decisions as much as we can together.
Yeah, Pam, so you were just mentioning how the modelling helps you with your economic response plan. Could you just give us a bit of information about how that's helping you with your economic response plan? And also, just separately, have you had any employers push harder on getting you to freeze that increase in the superannuation guarantee as a mechanism for helping them get through this period of time as well?
No is the short answer to the second question. It's not a matter that's been raised with me. I can't say it hasn't been raised with anyone else, but that's not a matter that the government is currently considering, or considering, I should say. The second point is there are two parts to those charts. One is the peak and the other is the breadth. And the states and territories and I are very conscious that the path out of this is not just about avoiding the peak, but being able to get back to some sense of normality that will enable the economy to support Australians without the need for the unprecedented JobKeeper and JobSeeker supplement type supports that are in place, because that is finite. That cannot go on forever. That will revert. That will go back to where it was before. So we will be working to address both of those issues to ensure the health system can cope, but also to ensure that the duration of where we have to put limitations in place can be minimised. And that is very difficult. That's why I've talked from the outset that there is a twin crisis that we are fighting here. We are fighting on the health front, on the virus, and we are fighting on the economic front to protect people's livelihoods. Saving lives, saving livelihoods, that's our plan.
Prime Minister, you spoke about how you hope the modelling work will give you an idea of the path out of this. Professor Murphy said that better hand hygiene will be with us to stay. How do you think Australia will look as a society on the other side of this crisis?
Well, it's a question I think we're all asking ourselves, and how we can best put in place the policy environment that gets the best outcome on the other side. And I think as Australians go through these many months ahead, it'll change many of us and our behaviours for a long time to come, and in some cases not in necessarily a bad way. There will be things that we learn from this experience, which I think will be very important. But the other side of what we're in currently at the moment, I think highlights the need for us, of course, to be an open trading nation. That has been a core part of our prosperity over centuries. But equally, we need to look very carefully at our domestic economic sovereignty as well. And these are issues that the government, particularly the federal government, is spending a lot of time focusing on at present. Up the back and then...
Prime Minister, this morning Gladys Berejiklian said that if social distancing measures wouldn't be lifted until a vaccine was realised, and we're hearing that that could be for potentially a year or even longer. What's the AHPPC's advice to National Cabinet on that? And just further on the same issue, in terms of testing, we're seeing that the guidelines are being lifted to some degree and you're testing a bit broader, but is there a point at which you would be testing asymptomatic people that aren't necessarily in a risk category to see if this virus is lying dormant in any other populations?
I'll let Professor Murphy talk to the testing, other than to make this point that the testing resource is also globally largely finite, and so testing resources need to be applied where they're of greatest use, and I know that's the strategy which is being followed by the medical profession. In relation to the comments you referred to from Premier Berejiklian, I know, having spoken to her, that her position, I think, is not as hard and fast as you may have represented. I think that there is a very practical and pragmatic approach being followed by all states and territories, and that the restrictions are one of the many levers that we have to pull in terms of getting this under control, but also at a point where we can actually move forward again and start to ease them. Now, that's no time soon, I should stress. That's why I say this Easter, make sure you follow all the rules in staying home and enjoying Easter with your own household, and spending that time there, because that is what is going to save lives and save livelihoods. And so it is important that we deal with this on a week-by-week, month-by-month process. And where we're in a position to make changes in the future, then of course we will. Because that would be in the national interest to do that ultimately, so long as we don't compromise the other battle we face, which is on the health front.
So on testing of asymptomatic people, there really isn't a lot of evidence about it. The one place we will likely do that is in aged care facilities. If we find a case in an aged care facility, because we've seen some asymptomatic cases and because this virus wreaks havoc in aged care, that's a strategy that we'll be undertaking. At the moment, we think the yield is more in testing people with acute respiratory symptoms in areas of community transmission. So that's where we're broadening the testing at the moment. We will look at the data on asymptomatic carriage there. It's not clear yet how significant that is, or people who might test positive and they're well, how infectious they are. So that data is still emerging.
On cruise ships, at least 17 of our sort of 45 or so deaths now are related to cruises, are linked to cruises in the cruise industry. Do you think that industry needs to take a fair portion of the responsibility to do with this? And do you see that industry changing long-term beyond the pandemic in its practices and so on?
Well, I'm sure every single sector in the country, whether it's cruise ships or anyone else, will be reflecting on these very difficult experiences that they've had, both negative and otherwise. And they've largely been negative in terms of how they would deal with these sorts of issues again in the future. In terms of the cruise shipping industry, like many other sectors, they have got caught up in these early phases because people were out on cruise ships, and that was always going to present some very difficult transitional issues in these early weeks. And there was no simple way through all of that. I mean, what I think is important to understand is what the virus has done has pushed pause on the global economy. Now, that has never happened before. It's never happened before at this scale. And when you think about the global economy and everything that connects all around the world, people on planes, people travelling, people on business, supply lines, resources on ships, all of this, and then all of a sudden it gets paused, then that's going to cause the obvious complications that we've seen. And so that's been difficult. And there have been issues, no doubt, that I think everyone would hope would have gone differently. But I think on occasion, we just have to step back a bit and just reflect on how significant the impact has been here. And everybody, even if they've made mistakes, I think have been trying to get this right. Journalists have been trying to get it right, and you haven't always got it right too. Others working in government, people working in industry, they've been trying to get it right. And I think we've got to give people a bit more of a break in those circumstances. Sure, there's things they should have learned, and sure there's things that should be done better, and sure there are things that need to be done differently in the future. But you know, right now, I've got to deal with today's problems, and I've got to deal with next week's problems, and next month's problems, and the road back. And so I can't allow us to get too held back in things that have already occurred. We've got to learn from them, sure, but the in tray's pretty full on a lot of other things. Phil. No, I'm sorry, we've had one question, Phil.
Prof Murphy, you said in response to Michelle's question about the eradication theory that one of the downsides of that may be that you don't build up a sufficient immunity in the community. Do you have a benchmark in mind for what percentage of the population needs to have developed an immunity over time before we can start sort of returning to normal?
The short answer is no. Some people believe that you need over 50% immunity to up to 60%. And we're not. And to be clear, we're not pursuing a path of herd immunity. We are pursuing a path of control and suppression. But if you did want to get that sort of level of immunity to prevent transmission, it's probably at that level. But we don't know yet. That's modelled on other viruses. There's no community in the world that has very high immunity as yet.
Behind.
Just wondering about this 6-month time frame that we've been told about. Does it come from this highly theoretical modelling? And if so, how much can we trust it? And in a few weeks when we have the Australian data, will we possibly have a different time frame?
Well, the 6 months was based on some early work that was done, but also, I should stress, it had factored into it the scale of the response that we can provide in terms of supports. So all of these things come together, and we'll have to keep this under constant review. But it was important that we, I think, had a realistic initial time frame to work to be able to construct things like JobKeeper. I mean, we could have done what other nations had done and said, oh, we'll put it in this place for a month or 2 months or perhaps 3 months. No, we said, no, if we're going to do something, we've got to be able to do this for the foreseeable period that we can currently about the extent of this pandemic. And so we took 6 months, and to the best of my knowledge, we're the only country that have been thinking about it in those sort of longer terms. And that's important because $130 billion on JobKeeper is significant, absolutely significant, unprecedented. And if I had said to you that this was only going to cost $65 billion and it was over 3 months, I think I would not have been upfront with the Australian people. I would have had to have said, as we have done, that we think that's at least what we need to do, and that is going to draw heavily on our capability. But at least we know, and Australians can know, and this will be in the Parliament tomorrow, and it'll pass the Parliament tomorrow. It'll pass the Parliament because it must pass the Parliament, because Australians need the certainty of that lifeline for that next 6 months. This buys us this next 6 months as we work with the medical professionals to chart our way through and out of this. This is an absolutely essential lifeline for Australia that is unprecedented in its scale and its scope and its coverage. And this will provide Australia what we need to get through this next 6 months, and hopefully that gives us the time we need to chart our way through and out. Andrew, and then Andrew.
PM, thank you. In terms of commercial tenancies, what happens if a landlord doesn't want to engage with their tenant in this process? Even though it's a mandatory code, is there a way a landlord may not do it, may not engage and negotiate in good faith?
They're required to do it. So in not following the legal requirement, they would be forfeiting their rights under the lease.
So there's no way out of it for a landlord, is what you're saying. And at risk of being a bit cheeky, can I just get your reaction to the George Pell decision today?
I'm staying focused on the coronavirus today, thank you very much. The High Court has made its decision, and I know for many Australians, the memories of things that completely unrelated to that case, which has now been addressed in the High Court, just the mere discussion of these topics brings back great hurt. And when these things are raised, my thoughts are always with them. But the High Court has, the highest court in the land, has made its decision, and that must be respected.
Thanks. Professor Murphy, just back on the modelling, we saw some really horrific levels of infection just a few weeks ago. It was in the mid-teens, higher. When it comes to the modelling, what rate of growth, because you are talking about managed rates of infection in effect with the push and pull of various levers, what rate of infection can we tolerate without pushing the ICU availability? And I've just one to you, second question. You talked about a pandemic period. What is the definition of a pandemic period? Is it simply a declaration of the National Cabinet, or is there some other metric?
So the answer is we don't know, Andrew. That's what the modelling is going to look at the moment with our Australian data. So certainly we're very confident with the growth trajectory at the moment, but that can change, and particularly that community transmission is what we have to look at, and we will be doing Australian modelling on that. So I can't give you an answer to that today, but we will in coming weeks, if that's the course we pursue, because the National Cabinet has asked for a range of options of how we come from. Some people have created the analogy we've got ourselves on a life raft, unlike the US and other countries that are still in the water. We're on a life raft. We now have to chart the course of where we take that life raft, and the National Cabinet wants considered advice on all the directions, and we don't have those answers yet.
Pandemic period, I mean, when you're talking about the Commercial Tenancies Code, for example, is mapped to the Job Seeker program, which, as you know, began last Monday week, technically. And that runs out for a period of just over 6 months, around 6 months, and that can obviously be extended or retracted based on the assessments made by the government at any point in time, considering all the issues we've been discussing with you today. The JobKeeper program has become, if you like, a key building block, not just for the federal government, but also states as well, who are tagging a lot of their supports and assistance to those businesses who find themselves in those situations. So it's not a scientifically defined space at the moment, but it is certainly assisted and being defined by the scientific and medical advice that we're receiving. So that's what we refer to when we say the pandemic period. We're going to leave it there. I'm sorry, you didn't have a question before.
Can I just ask very quickly, this forthcoming modelling exercise involving the Australian context, Prime Minister, will you guarantee that you'll be able to release the underlying assumptions when that modelling comes out as well?
It's just demonstrated today. You're getting everything we've got. And I think that's the approach we've been taking all along. We've been very upfront with the Australian people, and the National Cabinet equally wants to be very upfront with Australians about this. That's why we've spent quite a bit of time today going into some detail, explaining the qualifications around the information that we've provided to the public today, but in particularly to the media, and we would hope that that is appropriately reported in terms of what it is and also what it isn't. And so we will continue to be upfront with Australians. But as we close off today, there are 301 Australians, based on the information I received this morning at 6:30, who are in hospital. Some 93 of those are in ICUs. Some 36 are on ventilators. And it's a reminder with the 42 fatalities that we've had that there are many Australians out there at the moment who are just going through such a horrible time beyond the isolation, beyond the inconveniences of the restrictions and also the terrible economic loss. There are those who are dealing with lost loved ones. There are those who are dealing with family members who are in ICUs. And there are those who are fearful that others might fall into that situation. And this is a heavy burden for those Australians to carry, and we need to assist them in carrying that burden as well in the way we deal with these issues. And to Boris, we're with you, mate, and we hope you get well soon.